Hi everyone. My health education idea is to address the cultural context of health disparities among Alaska Natives through a youth focus group. It is a program to raise awareness and assess the attitudes on community prevention methods among Alaska Native youth. I'll start with giving you a little bit of background on health disparities among Alaska Natives. The Alaska Native population experiences numerous health disparities that contribute to many problems within our community. Alaska Natives have higher mortality rates than all other Americans for a number of conditions like diabetes, liver disease, respiratory disease, assault, homicide, and intentional injury. Despite many governmental efforts, Alaska Natives continue to experience a higher prevalence of substance abuse and mental health disorders, as well as a lack of access to appropriate quality care and culturally relevant services. Substance abuse and suicide are two areas I focused on throughout this project, so I provided some health statistics that illustrate the problem. There is an abundance of research showing that one of the biggest challenges and barriers to reducing health disparities among Alaska Natives is the clashing approaches to mental and physical health care. The colonization of Alaska began with Russia and a small number of other European nations in the mid 1700s, which essentially sparked a cultural clash between indigenous Alaskans and European colonizers. The results of colonization essentially tainted the Alaska Native history with oppressive treatment from the dominant societal group who viewed the indigenous people as inferior to them. The picture that you see is a powerful depiction of this oppression after colonization. The image shows a boarding school where Alaska Native youth were sent to assimilate into Western society. You can't really see, but the sign in the back says, "Please do not speak Eskimo." Alcoholism, drug abuse, and homelessness were foreign concepts to the Alaska Native people. Western colonization exposed them to these types of social, cultural, and economic changes that basically threatened their traditional ways of life. In connection to community health, a major outcome of this problem is homelessness among Alaska Natives. According to point-in-time counts from homeless organizations, Alaska Natives comprise a large percentage of Anchorage's homeless population. Alcohol and substance abuse is one of the core contributing factors to the worsening. The persistence of this growing community issue raises questions regarding not only its underlying causes, but also the methods governing how homelessness and the issue of these health disparities is being addressed. Previous research has shown that there is a lack of cultural competency for Alaska Native within current health systems. Um, Basically, in order to eliminate these disparities, it is essential to identify their underlying causes and address them. My health education idea is a campaign to raise awareness and assess attitudes on health disparities among Alaskan Natives in connection with cultural factors, so we may assess community prevention methods and gain a better understanding of the potential solution strategies from the perspective of those who are most affected. Applying Paulo Freire's model to a health education intervention, the program would target adolescents and young adult Alaska Natives through community centers like churches or college campuses, and participants would essentially form a focus group led by the program educator to facilitate a process that aims for participants to eventually form a coalition or some sort of group to participate in the process of developing an intervention from the discussion and ideas generated through the group. The need for this type of approach to this problem stems from the fact that perceptions on the underlying causes of the health disparities and related issues like homelessness are vastly different between the dominant Western culture and the Alaska Native people. This ultimately results in Western-based interventions that have had little effect on making significant positive changes. Paulo Freire was a Brazilian educator, philosopher, and political activist who developed a model used in health education, community organization, and social work. The basis of the Freirean model is that education is a means of freeing people from a culture of silence from which they live. The theory is an important example of how education can be used to bring about social change, that through dialogue, people can be liberated to make positive changes. This model focuses on a non-traditional educational experience where there's no hierarchical relationship between the educator and the student. The teacher basically acts as a guide for participants to make these causal connections and arrive at their own conclusions. The model consists of three phases. First is the naming phase, which asks the question, what is the problem at hand? Second is the reflection phase, which asks the participants to reflect on the problem discussed during phase one by asking questions like, how do we explain the situation and why is this the case? In the context of my idea, this process would essentially be facilitated with asking the group to describe what they felt and observed, define the levels of the problem, share similar life experiences, and question why the problem exists. So this process of dialogue ultimately leads to the third phase, or the action phase, which asks the question, what can be done to change the situation? There are 5 constructs within the model used in this program, and those include dialogue, conscientization, praxis, transformation, and critical consciousness. This is a detailed diagram which shows how the program can apply the constructs of Freire's model as it relates to the educational process. So dialogue is the construct that aims to develop a concrete awareness of one's social reality. This is accomplished through discussion facilitated by the teacher but led by the student. So next is conscientization, which involves identifying and addressing the underlying systematic forces of oppression and inequality. So in other words, discussing the societal contributors to things like suicide and alcohol-related behaviors. For this program, the goal would be for participants to come to their own conclusions regarding the root causes of these types of issues through brainstorming and personal reflection, as you can see there in the diagram. The construct of praxis is also referred to as reflective action, or in other words, integrating theory to practice or shifting away from discussion of the problem to discussion of potential solutions. This allows for the participants to create a specialized project or task and working jointly with the teacher to accomplish this. So that would be the pilot project that would facilitate the construct of praxis within Freire's model. So because the whole goal of this model is basically to have the participants arrive at their own conclusions, the specifics of whatever pilot project they select, they would have to come up with on their own, essentially something like ideas for solutions, brochures, a campaign, something like that. Next is the construct of transformation, which is changing the participants from seen as objects to subjects. What this means is instead of acting as an oppressed person and learning to live in their current system, instead we seek to transform the system to become independent beings for themselves. Using a relevant case study in discussing it as a group and then reflecting on the process is a way to modify and apply the construct of transformation. And critical consciousness is the final construct, and this refers to the political organization and action of those affected by the health problem. So as mentioned before, a goal of this process is to empower the participants to form action groups, coalitions, or some form of continuing effort to actively participate in the implementation of the solutions or ideas generated by this program. So the objectives of this program would be to gain an understanding of the attitudes and beliefs of Alaska Native young adults on health disparities and its impact on the community, raise general awareness of these health disparities and associated adverse health and community outcomes, identify and prioritize the most concerning areas. This allows us to see from their perspective what they feel are the largest problems in need of the most attention. Analyzing the historical context of health disparities among Alaska Natives allows for them to get an idea of how their cultural circumstances brought them to the place they are today, and allows them to see the context of their own social reality. And last, from this process, we would hope to facilitate the formation of groups seeking to take action to make positive changes. That way, we can have the members of the community that are most affected by this problem are the ones that are developing the solutions and the ones that are cooperating in the process of implementing the program, which brings the community together overall and makes the chance of success with programs like this that address cultural issues much more likely to succeed. Thank you very much for listening, and that is it. That is all for my presentation. Here is my reference slide.